Now, I would like to ask Dr. Sahana, the next cause of leading death has always been the stroke. So, I would like to ask you what single step you would like to suggest for a healthier.
Thank you, sir. Stroke is a very important concern these days. So, if you see the statistics, in India, every 4 minutes somebody dies due to stroke. That is very, very significant, and it is the second leading cause of death in India. So, when a patient has stroke, the most important is identifying that the patient could be having a stroke. So, what we say is the FAST is the mnemonic that we use. So, where the patient can have facial drooping, that is for F. A is ataxia, where the patient can have imbalance. S is slurring of speech, and T is any postural or limb weakness. So when the patient has stroke, the first thing is to bring him to the hospital within the window period. So the window period for stroke is around 4.5 hours. So if the patient comes to us within the window period, the stroke team is alerted. So we get initially stabilize the patient, we get a neuroimaging done, that could be an MRI or a CT, and depending on whether the patient has had a bleed or a clot. So if the patient has had a bleed, then we just have to give supportive therapy, we observe the patient. But if the patient has had a clot, we can thrombolize the patient if they come within 4.5 hours. So depending, definitely based on their comorbidities or previous medication history, we take the call on the size of the infarct, we can thrombolize the patient. And there's something known as bridging thrombolysis, where we can thrombolize the patient and then refer them to mechanical thrombectomy, where we put in a catheter and remove the clot so that the blood supply to the brain improves. So, and then after that is the stabilization and the observation part of it, and followed by that is a further physiotherapy and preventive therapy, which helps in the good outcome of the patient. Now, what are we targeting with all this is to save the penumbra, or save the part of the brain which has reduced blood supply but which is still not dead. So by doing thrombolysis, providing medications, by providing mechanical thrombectomy, we save that part of the brain which is salvageable and which will definitely help in a positive recovery of the patient.
Thank you, Dr. Sahana. This is regarding the treatment of a patient who has sustained a stroke. Now, I would like you to suggest the preventive steps for a healthier, I would say, mental health or the brain health.
That is very important, like sir stressed. Brain health is very important, inclusive of mental health. So we all concentrate on physical health, but mental health is not concentrated on, because what you don't see, you don't treat. So we have lots of patients, we deal with depression, anxiety, panic attacks, that is on the rise recently, at the recent times. And they go unnoticed, they hide in plain blind sight. So mental health is as important as physical health. So how do you maintain a good mental health? So I would suggest activities like physical exercise, maybe yoga, meditation, and to maintain your memory also, to prevent early onset dementias. It is good for you to do some new exercises every day, for maybe solving puzzles, learning a new musical instrument, doing artwork, or anything outside your physical or daily routine. So learning new activities stimulates the brain and helps to preserve your memory. And now the new thing in discussion in our neuro society is the gut-brain axis. You are what you eat. With the onset of Swiggy, Zomato, the nutritious food has come down the line, but you need to remember you are what you eat. So if you eat nutritious food, even the brain neurodegenerative diseases takes a back step. So that includes, like sir has already mentioned, good fruits, vegetables, whole grains, avoid processed sugars, avoid alcohol, tobacco. So maintaining a healthy mind or a sound mind is as important as maintaining a healthy body.
Thank you, Dr. Sahana. Dr. Harsha, our orthopedic surgeon, I would like to ask you what single step that you would like to suggest a healthier you. Nowadays, a lot of people have joint problems, neck ache, backache, even the young and the old. Everyone has the same issue.
Yeah.
What steps that you suggest?
So I would suggest more than a few thousand steps a day would be a good beginning. Basic physical activity, maybe it's walking, some sort of exercise regimen, it could be yoga, swimming, or any other sporting activities one is interested in, goes a long way in maintaining joint and bone health. That keeps the joints healthy, because often we see in our clinics patients walking in with bad knees that has been hurting for months on end without much of relief in the symptoms. And we get an x-ray done and we see a worn out knee joint. Once we search, the most definitive treatment available for a worn out knee joint, the arthritis, is, as you know very well, it's knee replacement. But patients have a lot of misconceptions about the treatment option, which is the most viable option right now. which is, in fact, knee replacement, as you know, is one of the most successful surgeries in orthopedic specialty itself.
Yes.
So patients should feel quite comfortable and be more, in fact, be less scared of the procedure for better outcomes and reach those steps, 4 to 5,000 steps a day for healthier body and bones.
So what you're suggesting is having a lot of exercise, moving out, and even if they are at work, they need to move around, sit
Definitely,
around.
definitely, yeah.
And then if they are in trouble, they have to seek the professional help. And knee replacement, or for that matter, any joint replacement surgeries are as safe as any other surgeries.
Exactly, exactly.
Dr. Asha, I would like you to comment on this aspect of the thing. The third leading cause of death is the road traffic accidents, the avoidable deaths that we see every day in our newspaper. It's like sensex. Some people die more on a day, some people are less, but it will be there every day. So, what steps you suggest to prevent, to decrease the mortality in such case of accident?
Like you said, road traffic accidents are a very much avoidable cause of mortality and morbidity. I think simple step, very basic steps, following traffic rules, wearing your seat belts, please wearing a helmet. Please do this for yourselves, not for the police, because that goes a long way in preventing such incidents. But in spite of taking such precautions, one may end up with an accident. So following such rules definitely brings down the number of accidents. But if one ends up in such an situation, I think immediate professional medical help would go a long way in restoring mobility.
Dr. Harsha, our professional colleagues are bombarding us with the golden hours. I would like you to tell us something about the golden hour in our specialty, I would say, in case of accidents,
Yes, yes.
the importance of it.
Yeah. Patient coming into the hospital within 60 minutes to couple of hours would definitely help us in categorizing the patient depending on the intensity of injuries and the number of injuries, whether there is head injury, brain injury, or just the limb injury. So we triage the patients based on the kind of injury one has sustained, and accordingly do the required scans and investigations and stabilize the patient before we go in for all this evaluation. We just initially we go for the stabilization of the patient depending on the number of injuries, and triage the patient into different categories. It's a neurosurgical intervention required, or abdomen injuries, or just limb injuries, and accordingly we treat the patients.
That was a great discussion regarding the healthier steps towards a healthier society. I would like to thank Dr. Jayakumar, Dr. Sahana, Dr. Harsha for their contribution, inputs to preventing the.
Healthier.
These are all the steps that you guys have to take for a healthier you. Thank you once again. A very happy World Health Day to you all. Good morning to you all. A very happy World Health Day to you all. On the occasion of World Health Day, we have a small discussion. We have with us Dr. Jayakumar, our cardiologist. We have Dr. Sahana, our neurologist. We have Dr. Harsha, our orthopedic surgeon, and myself, Dr. Jagadeesh, orthopedic surgeon. So, firstly, I would like to ask Dr. Jayakumar, what one single step that you would like to suggest for a healthier you?
Namaste. Thanks for to begin our discussion. That was a very nice question. See, lifestyle is most important. I believe in prevention is always better than cure. So, healthy lifestyle can lead not only in preventing the disease, but it leads to a healthier mindset and healthier body, and helps to fight the disease also. Steps towards healthy lifestyle, but I can go on add hundreds of lists to it. But to begin with, I'm going to speak on three aspects. Okay, one is our body constitution, the physical body. The second one is what we put inside our body, like it includes our drinking, smoking, food habits. The third one is the mind, of course, because younger generation we are seeing that many are stressed out because of various reasons, because of finance, social, or professional stress, they can't handle it. So to begin with, what we food, I'm going to speak on 1 minute on food. See, always includes a lot of fruits and vegetables in the diet, and always try to avoid processed food. Also, we're going to say to avoid three white things in our diet. One is the salt, one is the sugar, and third one is the refined flour or maida. So these are actually slow poisonous food habits in our body. The second one is smoking. Always should be a non-smoker or quit smoking. Alcohol, always moderate it and try to increase the in between duration between the alcohol intake. The second one is always maintain ideal body weight, maintain at least some type of physical activity, like even 30 to 40 minutes, even 3 to 4 days a week is sufficient to maintain your healthy lifestyle. The third most important, what we feed into our mind. I think that to begin with, sleep is quality of sleep is important, and de-stressing yourself, especially I always try to say to my younger generation, younger friends, younger patient, please de-stress yourself. The third one is always be cheerful and gratitude towards your life. Always make spend time laughing with your friends, family, kids, and always try to be on a positive mode. Thank you.
Thank you for the preventive aspects of the cardiac health, Dr. Jayakumar. I would like to ask you what other things that if the patient has sustained a myocardial infarction, what immediate measures that you would like to suggest?
That is a good question. See, any patient developing heart attack, what we call it as a golden hour, that within 60 minutes, the patient comes to hospital. For example, our tertiary care hospital like ClearMedi Multispeciality Hospital, if a patient comes, any patient comes with chest pain, in the emergency room, immediately we're going to take detailed history of the patient, we check the vitals and get the basic ECG done. So by vitals and history and ECG will come to know that the patient has developed a heart attack or not. Okay. Once we confirm that the patient has a heart attack, so we're going to give the patient the required medications. We're going to immediately activate a team of people that includes the intervention cardiologist, cath lab technician, cath lab scrub nurse, and intensivist. We're going to take care of all this patient. So once the patient has been ready, we prepare within 10 to 15 minutes. The patient will going to give the essential life-saving medication, and we're going to shift the patient to the cath lab. In the cath lab, we'll initially do an angiogram. Angiogram is a test to know the condition of the blood vessels of the heart. So usually we do angiogram for three purposes. One is to know really whether blockage is there or not. The second point is if there is any blockage, the next question comes, where is the blockage? Which arteries get blocked? What is the percentage of blockages are there? Third point is what should be done for it? Whether we can treat only medically, whether patient requires an angioplasty stenting, or if the patient can referred for surgery. So in this golden hour, we try to do all the things from including from giving medication, stabilizing the patient, shifting to cath lab, doing an angiogram. Once we do an angiogram, confirming the blockage and clearing the blockage with angioblast and stenting and re-establishing the blood flow. So all this, what we call it as a golden hour, or in medical terms, we call it as primary angioplasty. So irrespective of time of the day, 24/7, we try to provide this type of service so that we're going to reduce the mortality of the patient.
Thank you, Dr. Jayakumar. That's the importance of golden hour. That is the first 60 minutes within a heart attack. Somebody should come to the hospital and get themselves treated.